a novel nano-silver ion-based self-preservative free technology by Dr. J.S. Titiyal.
Good afternoon. Thank you, Ilan, for running this important session here. Unfortunately, it is clash with the OPL. And I'm going to talk about something. Yes. We're going to talk about something which is, innovative, and thanks to mankind, which have worked on this particular aspects of preservative-free dispensers. No financial disclosure from my side. Let's talk about the maximum, topical medications today are used for dry eye disease. And it has a huge impact on our society because everywhere in the world, dry eye is one of the leading cause of discomfort and the painful days for many, many people working in our different areas. Africa and India has South Asia has the largest amount of people suffering from dry eyes. If you look into prevalence of dry eye disease in India, these are two studies available, one from RP Center, one from LV Prasad, where we're looking for a global estimate of prevalence is around 5 to 33%. But in India, it is from 18 to almost 55%. And mostly, if you look into the difference between India and globally wise, in global area, you have evaporative dry eye or MGD in a huge number, almost 50%. Well, India, it may not be 50%, but still it is a significant number from our side also. So this is the published article from RP Center in IGO, where we looked into a large number of patients coming to our OPD, and we subjected them to OSDI questionnaires. We found almost 32% coming to RP Center OPD had a clinically significant dry eye disease, which you look into, we see almost 5 lakh patients a year, and this is a very significant number of patients having these symptoms, not coming for a dry eye treatment, but coming for other purposes also. And this is a study from LV Prasad, where they looked into the 8 years data of more than 1.4 lakh people, and they found that incidence is almost 1.5%. In there also, the age group, like people, urban residents, professionals, 5th to 6th decade people had a high incidence of a dry eye. And they estimated by 2050, it will be almost 50% people will be suffering from significant dry eye problems, which is almost 2.75 million people. This classification and treatment profile is well described for all of us, how to manage these patients. And you know that step 1, step 2. One thing which is very prominent here is the non-preservative lubricants, because that is what is required for a chronic management. So this was a question I put for my students also. What is the most commonly used ophthalmic solution? And for people, they answered artificial tears. It is true that it is very commonly used, and most common one has been CMC for us. Now sodium hyaluronate is getting a #1 position in this category also. So whenever we have to use drug for a longer term, we have to preserve the drug in such a manner where it is not getting infected, because infection is a rare opportunity for bacteria to grow in the dispensers also. Therefore, you need to have innovative devices where either the dispenser will have some sort of controlling the anti-infective organisms by preservatives, or have some sort of a single dose dispensers also. So these are various preservatives which have been used for ocular therapeutic drops. And we all know these preservatives are going to damage ocular surface very, very seriously sometimes, which can cause discomfort, tear film instability in early. Later on, it can cause serious inflammation with subconjunctival fibrosis, the epithelial apoptosis, and sometimes the corneal surface impairment, which can ultimately create problem for a patient undergoing various procedures like refractive surgery, corneal surgeries, or a cataract surgery also. Therefore, there is a definite need of a preservative-free medication, especially glaucoma patient, where they have to use lifelong medication, patients on a contact lenses, patients having allergies, or patients who have been using artificial tear for more than 4 drops a day. So these people will definitely require. So there has been a lot of efforts to have a single dose containers. Those are unims, and they are costly, but very difficult to have in the Indian scenario also. Or you have a multi-dose dispenser, which are normally Novelia technique, where they have systems which can be giving one drop, and there's some sort of valve action where air can pass through reverse way, and it also has a filter to prevent, prevent the bacteria to go inside the bottle also. With this type of manufacturing, the bottle become very hard and difficult to press, and patients do have difficulty, especially older patients. Therefore, there has a need for something which is comfortable to patient and also preserve the medications also. This very novel technique, which is by mankind, is known as a silver nano ion technologies, which is a bactericidal, fungicidal, has a virucidal activity also, effective biologically and non-toxic to the eyes also. And one of the first drop to come is a Lubimoise, which is 1% sodium hyaluronate, 0.1%. And this technology, silver ions are in the powder form in the bottle, nozzle, and cap. And that causes bactericidal activity. And there's no side effects onto the ocular surface, non-corrosive. So that is the importance here. So anything which comes in the market, you have to go through this serious, rigorous testing of antimicrobial activity. So they looked into these areas to see if this device can be effective here. So you can see if you have acceptance criteria as 1 log mark reduction at 7 days and 0.3 log mark at 14 days. So this is the challenge of microorganisms, right from gram-negative to fungus. And it is definitely more than the required log mark values. So this is the second batch, this is the third batch. In all three batches, it was very effective to know that it was very effective in decreasing the load of contamination in these cases. It was very safe. Lubimoise with this technology also acceptable. The second would to challenge the bottle in terms of safety-wise. The one was in use whole time study where they opened the bottle 3 times a day and capped and took a culture at 10 days, 30 days, and 60 days. In second sample, they challenged the device with putting the microorganisms of a significant number, and they also titrated 10 days, 30 days, 60 days. In both the devices, both the techniques, it was very effective in decreasing the load of bacteria in 10 days, 30 days, 60 days. And it is very, very effective in combating the infective agents in these cases also. So if you see that this technique has major advantage in 4 ways. One, it doesn't leach the silver, and it is non-corrosive to the ocular surface, non-toxic to the eyes. Also has a broad spectrum efficacy against all types of microbes. The most important thing is cost effective, which is very useful in Indian scenario. Very convenient to patient. If you press it, it is very soft, and at one time it only gives 1 drop. So it is also very, very, we can say cost effective for our scenario also. In that way, it is a real innovation in terms of a multi-dose dispenser in Indian scenario. I think there is a definite need for us to look into one more area of expanding this device to other areas like anti-glaucoma medication. I think mankind is already working on that. If it works out in anti-glaucoma medications also, that will be very useful in decreasing the costs and getting more compliance for the patients. I think cost and compliance should go together, especially in a disorder where blindness can be prevented. So I would say this has been a real good thing for all of us. So this technology definitely needs to be studied for other types of topical medications, if not for antibiotics, definitely for anti-glaucoma medication. Thank you for kind listening, and hope that mankind people are listening and they'll do a better job for future also.
So,
Yeah.
yes.
Yeah, Namrata, you're asking
So
some
I
question?
just wanted to ask, this technology is going to be there for all the bottles, the Novelia kind of.
No, just now, this is a little different from the Novelia technique. This doesn't have a filter inside, the HEPA filter type of thing. And it doesn't have the device where, things can go reverse. That if you have that device, it becomes very, very hard and difficult to press also. This is a device where your silver ions are there in a cap and nozzle. So that effectively takes away the antimicrobial load into those areas. So it's like a bottle which is softer. You can squeeze very comfortably, and effective dosing can be there. And I hope that they'll come out with the other areas also.
Sir, my only question is, I think the silver ions are there only at the tip. That's where it is. But there can be some reverse flow after putting the drops. That's quite
So
common.
it is there inside also. It's the coating is there, which is also acting for that longer time. But if you combine the HEPA filter and all that technique of Novelia, then it is going to cost at least 3 or 4 times more. So, or effective way to look into a cost effective and also having a prevention of infection also.
Thank you, sir.
Thank you. Yes, it's available freely, and cost I'm not sure, but effective to. How much you said? Okay, 300 रुपया एक पूरे 10 ml के लिए, तो पूरे जो है 3 महीने चलेगा.
Yes.
Thank you so much, and sorry we have to leave you people because we have to be a part of OBL team. Thank you.
Thank you.